Hi, I'm Dr. Nikita Visniak, and I'd like to introduce you to our ProHealth posture chart. Like a regular posture chart, you can have your patient stand in front of it and look for subtle variations with the grid pattern on the back, but we have a few innovative changes that we've added to it to give it more clinical utility for you in practice. One of the key things is the use of a height measurement scale in both inches and centimeters, so you can measure your patient pre-treatment, usually a little bit shorter, and post-treatment, how they're a little bit taller. A couple of other unique things we've added to it include a Snell and eye chart with red-green color blindness testing. And we also have pictures of the anatomy of the area. So you can look at it musculoskeletal system for the entire body and look at common nerves, deep muscles, superficial muscles, and impingement sites. Again, a great educational opportunity for your patient to have them look at this and have a conversation around piriformis or quadratus lumborum or iliopsoas or the carpal tunnel, whatever else it is. Also including fascial chains and connections, so you can relate changes in one area of the body to pathologies and compensations in other areas of the body. Another key thing we've included is the text neck or computer spine issues that we're seeing very commonly in patients nowadays, with looking at your cell phone and as you lean more and more forward, the change that causes for stress on the lower neck and cervical spine and upper back. Direct conversation with your patient there. We've also included upper and lower cross syndromes, very relevant for patients in practice who are sitting at computer desks or truck drivers or anything like that, where you're spending a lot more time in a seated position. We also talk about disc load pressure with variations in lifting and the importance of good form and engaging the core and lifting nose between your toes. Key conversation there. Bring up conversation around tissue healing stages, so you can have this conversation again with your patient saying this is an acute injury, so we're still waiting through that area before we really work on this area specifically, or we're saying this is a subacute or more chronic issue, in which cases we're trying to reinitiate that inflammatory cascade to get your tissue healing away from that scar tissue in a more normal tissue type. We also talk about gait analysis with Pes Planus, Pes cavus, and how the foot should hit the ground, and you can talk about that with your patients. And basic postural assessment, of course. All the landmarks are given down at the very bottom, but you already know that if you're using this posture chart. Another key thing that we offer for it is the pain scale all the way across here, and ranges of motion for the entire body by the American Academy of Orthopedic Surgeons, so you can measure with this protractor, have a patient lean to the side and get a rough gauge for what their range of motion is, or the same thing for shoulder range of motion, put the arm above their head, and then you have a rough gauge for what that measurement actually is. But the real benefit of this poster is the fact that you can put your own clinic information up in this upper right-hand corner. What you'll do on your own printer, or you'll get a print shop to do it for you, is print off your clinic logo, name and number. You will take pictures of your patient pre and post treatment with their own cell phone, and then when they're looking at it, they'll be able to see their changes pre and post treatment, and if they need to get in contact with you again or refer somebody to you, they've automatically got it in their phone already to give you that little bit of, we'll say, free advertising and showing the benefit of the care that you're offering. So hopefully you find this as useful as many of our practitioners do, and I thank you very much for your time.